State advises providers to follow federal pause on use of Johnson & Johnson vaccine during review. Health officials not aware of any cases reported in Minnesota to date. The Minnesota Department of Health, MDH, this morning sent a message to healthcare providers around the state advising that they follow the federal recommendations to pause use of Johnson & Johnson COVID-19 vaccine. While the U.S. Centers for Disease Control and Prevention, CDC, and the U.S. Food and Drug Administration, FDA, review data about an extremely rare type of blood clot that has been reported in 6 people who received that vaccine in the United States. As of April 12th, more than 6.8 million doses of the Johnson & Johnson vaccine have been administered in the U.S. The CDC and FDA are reviewing data involved a rare, severe type of blood clot that was reported in 6 people after receiving the Johnson & Johnson vaccine. All 6 cases occurred among women between the ages of 18 and 48, and symptoms occurred 6 to 13 days after vaccination. While Minnesota officials are not aware of any cases occurring among the more than 184,000 Minnesotans who have received this vaccine, Minnesotans who received the Johnson & Johnson vaccine who develop severe headache, abdominal pain, leg pain, or shortness of breath within 3 weeks after vaccination should contact their healthcare provider. CDC will convene a meeting of its Advisory Committee on Immunization Practices, ACIP, on Wednesday, April 14, 2021, to further review these cases and assess their potential significance. The FDA will review that analysis as it also investigates these cases. Meanwhile, Minnesota Commissioner of Health Jan Malcolm said that until that process is complete, Minnesota health officials have advised a pause in the use of Johnson & Johnson vaccine out of an abundance of caution. Quote, "While this issue appears to be extremely rare, CDC and FDA are acting in a very cautious manner that underscores our commitment to vaccine safety," end quote, Commissioner Malcolm said. Quote, "We will be closely monitoring the federal review process and use that information to help guide our efforts here in Minnesota in the days ahead." End quote. The Johnson & Johnson vaccine represents about 6.6% of the total supply of vaccines Minnesota has received to date, so the pause is not expected to dramatically slow the pace of vaccines in the state. However, anyone who currently has an appointment to receive the Johnson & Johnson vaccine should watch for a notification from the provider about canceling, postponing, or rescheduling that appointment. If your appointment is canceled, you can look for other vaccination appointments through the vaccine locator map, local pharmacies, or your healthcare provider,